This is definitely not normal. I feel like we can talk about this with some nuance and it will make sense. So here we go. You don't have to do anything different just because you're on your period. Welcome back. Today we're talking about 5 female exercise myths about pregnancy and periods, and we're going to debunk them and give you some good information. I thought with 2024 New Year's resolutions coming up that talking a little bit about exercise and how it relates to periods and pregnancy would be a great topic. If you're new here and you'd like to subscribe, we would love to have you. Hit that subscribe button, turn on notifications so you never miss an upload. This video is kindly sponsored by Copilot. We'll hear more about them in a minute. I am a doctor, but I'm not your doctor. This is all just for informational purposes. Please, please, please check with your own doctor or midwife before taking any of this and putting it into practice in your real life. Myth number 1, you shouldn't exercise on your period. This is an old trope that often pops up in media and around the internet, and it's so silly to me that I almost didn't even include it here. But I wanted to include it because it's still something that occasionally comes up with people asking if there's any truth to it. There's no reason at all that you have to change your exercise routine because you're menstruating. In a video recently about PMS, I talked a little bit about how you actually might see some benefit to period cramps and other PMS symptoms like mood changes with regular exercise routines. There's no reason you can't maintain your normal exercise routine during your period. I'll talk a little bit later in another myth about some of the ways that your menstrual cycle and what point you are in your menstrual cycle and what your hormones are doing in your menstrual cycle may affect how you feel and what kind of exercises you want to do. But you don't have to do anything different just because you're on your period. Myth number 2, exercise in pregnancy is dangerous. This is a total myth, but it has some caveats. For the average person with the average pregnancy, there is minimal risk to exercising while pregnant and significant benefits. However, as I mentioned, there are some caveats to this. There are claims we used to hear a lot about exercise during pregnancy that have been fully debunked. Things like it will cause you to have a baby that is low birth weight or small for gestational age. Things like it could increase your risk of preterm labor or preeclampsia or birth complications. And all of that is completely false. So if you're active when you get pregnant, you can continue that, again, with some caveats that we'll go over in just a minute. And if you're not engaged in a routine, active, healthy lifestyle when you conceive, then you can view pregnancy as your opportunity to put some of those habits into place. The caveats to this are that you're going to potentially have more lax joints during pregnancy. This is because of a hormone called relaxin, and it does exactly what it sounds like. It relaxes your body tissues, and your joints are more lax. You need to pay attention to that when you are exercising. You also have some higher oxygen requirements during pregnancy, and you also are more likely to get overheated, and also your center of gravity shifts gradually throughout the pregnancy. So these are all things that you need to be aware of when exercising during pregnancy. There's probably some things you should avoid: contact sports, anything that's going to put you at a higher likelihood of injuring your abdomen. So I don't know, probably downhill skiing and boxing are not great ideas. Horseback riding can be a little bit more worrisome. Anything where you could potentially be at a really high elevation or deep pressure, scuba diving, skydiving, probably not great ideas. All of these things affect your physiology, and when you're pregnant, that will be affected to a higher degree. Now, you probably should have some kind of exam with your doctor or midwife or whoever's taking care of you to make sure you don't have anything that would be a contraindication to exercise or certain types of exercise during pregnancy. People who have a cerclage maybe, or placenta previa, particularly in the 3rd trimester, people with certain medical conditions and certain high-risk pregnancies. You have a higher chance of having a normal vaginal delivery if you've maintained a healthy exercise routine through the pregnancy, and you have a lower chance of getting things like gestational diabetes and certain high blood pressure disorders. This data from ACOG actually says the risk of preterm birth is decreased with a exercise routine. I haven't actually seen that data, but it's ACOG's publication, so I would assume they've done their due diligence. Lower risk of C-section, lower incidence of small for gestational age. So things that we used to tell people were worsened by exercise in pregnancy have not only been debunked, but actually the opposite has been found. In the absence of medical or obstetric contraindication that you have discussed with your doctor or midwife, exercise in pregnancy has lots of benefits and minimal risk for the average person. Speaking of exercise, let's talk about the sponsor of today's video, Copilot. What if I told you there was an app that could make you 9 times more likely to stick to that New Year's resolution of getting into a healthy exercise routine? Copilot is not your regular fitness app. They actually pair you with a real certified fitness coach. My coach's name is Chris. You meet with them one-on-one, go over your preferences, your goals, what kind of exercises you like, and they develop a personalized fitness plan just for you. I've been using Copilot for a while now, and I love that the app is really flexible. You can use it anywhere, at home, in the gym. You can even use it if you're like me on a 24-hour call in your office at the hospital. I think that's what makes Copilot so unique. Having a real person there to change things or give you advice on form or even just provide encouragement is so helpful. With over 75% of Copilot clients staying committed to their exercise routine after 100 days, Copilot is the best way for you to stick with your New Year's resolution of maintaining a better exercise routine. So if you'd like to try out Copilot and support my channel in the process, you can get a free 14-day trial and 20% off your first month if you sign up by February 1st for that 2024 New Year's resolution by using my link in the description box down below or going to the one you see on screen here. Happy New Year, and let's get back to the video. Myth number 3, it's normal for female athletes to lose their menstrual cycle. This one is really concerning that I found people saying that this is just something that happens to marathon runners and elite athletes online. People were talking about it like that was okay. And this is definitely not normal. If you are not having periods and you don't have a reason for that, that is a reasonable explanation, like pregnancy, menopause, you're on continuous hormonal birth control pills, you have an IUD, anything that would safely make your periods not be there, then it's not okay to basically lose your period. The reason that people say this is because it can be a fairly frequent event that we see in people who do high intensity exercises and things like marathon running and elite level gymnasts and stuff like that. But that doesn't mean it's normal. And it also doesn't mean it's not dangerous. It's not normal to lose your cycle just because you are an athlete. This is called functional hypothalamic hypogonadism because of the lowering of your fat mass in your body. You get an insufficient amount of hormone production from the pituitary. And that means that you have a trickle down effect. So you're not producing all the normal hormone amounts for your reproductive hormones, estrogen, progesterone, things like that. The reason it can be dangerous is because over a long time frame, 6-12 months, estrogen being low starts to affect your bones. It can also have other effects like on your fertility, your ability to get pregnant. Obviously, if you're not ovulating, then you can't get pregnant, which I guess some people would consider to be a positive, but in the way that it happens with this, it's not okay. It can also affect your general overall health and sexual function, but the main concern is low estrogen and lowering of bone density, which can be dangerous. Your period is a vital sign. And if we see that it suddenly goes away for any reason, that should be concerning to you. And we have to figure out why. Is it pregnancy? Is it something going on like we were just talking about with athletes? Whatever it is, you should treat a loss of cycle, particularly if it goes on for more than 1 month. One missed month, I don't know. If they come back, you maybe don't necessarily have to go in and be seen for that. But if they just go away and aren't coming back, that's something you should bring up with your doctor 100% of the time. Myth number 4, cycle syncing is more effective as an exercise routine. I have a whole video that talks about cycle syncing and the myth of cycle syncing, but let me quickly explain what this means. There is a subset of people on the internet who think that everything you do, eat, think, everything in life should be synced to your menstrual cycle. This is silly. There is no data that says you need to make nitpicky changes to what exercises you're doing based on where you're at in your menstrual cycle, or any data that says that making those changes would mean your exercise is more effective depending on where you're at in your cycle. Why is it that then you will see some doctors talking about this on the internet? Well, it is true that how you feel may change throughout your cycle because of the changes in your hormones. You may have times throughout your menstrual cycle where you are more energetic. Particularly most people during the first half of the cycle feel a little bit more energetic. And then post-ovulation until your period, people tend to feel less energetic. That is true. And so I think there's nothing wrong with being aware of those changes and saying like, if I just don't feel like going as intense in the second half of my cycle, great. But cycle syncing, as in we need to be obsessively altering what we're doing to make it more effective based on where we are in our cycle, nonsense. Almost everybody who tells you this is going to be someone who is trying to sell you something. Probably, most certainly, and most likely would be they're trying to sell you their system for this. And it's somebody who is, you know, a hormone coach or fitness influencer that's just made these things up based on no data. So there's no data that says all of these little tiny changes in what you eat or what you do being lined out on a microscopic level in accordance to your cycle would make them more effective or better for you. Interestingly, though, there is data on how your hormonal changes affect potentially injury and likelihood of injury. There is some data that says in the ovulatory phase of your menstrual cycle that you may be at an increased risk of ACL injury, which I found to be very interesting. Most of that data, though, is in real professional sports and dangerous type sports like skiing and things where you're more likely to injure your ACL anyway. And we also know that in like high endurance sports, marathon running and things like that, that there is a bit of a reduction in endurance during the luteal phase. So it's not silly to think that your endurance and your ability to want to exercise and your energy levels and things like that don't change with the cycle. They absolutely do. I just don't think we need to be hyper focusing on these little minute changes. The whole kind of take home message of this is give yourself permission to, you know, be less energetic and do a little bit of a different exercise routine during certain times of your cycle, but don't hyper focus and obsess, and certainly do not give any influencers money to teach you how to, under a microscope, change what you're eating or doing because of your menstrual cycle. Myth number 4, you can't start a new exercise routine during pregnancy. I must admit, I've probably said this in a video or two myself. This is outdated. You can start a new exercise routine in pregnancy, but you should talk with your doctor or midwife about it first. ACOG recommends 150 minutes a week for people who are pregnant as far as exercise goes. But if you've never had a regular exercise routine, maybe just start out with 5 minutes a day and every week add another 5 minutes. It's okay to start a new routine in pregnancy, and arguably a great time. You are thinking about your health as a more holistic approach to life. You are growing another person, and we know there are huge benefits to exercise in pregnancy. Just check with your doctor to make sure that you don't fall into one of those high-risk pregnancies or categories where it would be more risky for you to work out, that you don't have any obstetric complications that would be a contraindication to that, and talk with them about what you're planning to do. As long as you do all of that, it's fine to start a new routine while you're pregnant. There's important points about exercise in pregnancy too. You need to make sure and stay hydrated. That's obviously important anytime, but you're more susceptible to the effects of dehydration during pregnancy, so make sure you're drinking plenty of water. You are more likely to get overheated during pregnancy, so avoiding exercise in hot, humid conditions or things like hot yoga may be a good idea while you're pregnant, because you're more likely to get low blood pressure related to that and to overheat in general. You are more susceptible to things that if you're lying on your back for a long period of time, especially as you get further into the pregnancy, because the great vessels, aorta and IVC, run through your back. So when you're lying on your back and there's a heavy uterus pressing on them, you don't get blood flow up from the legs to the head or down away from the heart to the legs. It doesn't exchange very well. And that would put you at an increased risk of having a vagal effect or low blood pressure, which is basically like getting lightheaded or dizzy, feeling really bad. Sometimes it can cause nausea and vomiting. So don't lay on your back, flat on your back for long periods of time. I probably would avoid, exercising outside in Texas in the summer if I was pregnant. Myth number 5, you can't swim when you're on your period. This one is so interesting to me, and it's because it comes in so many different forms. We see people asking if it's dangerous to swim on their period because they might get attacked by a shark. We see people saying, is it dangerous because it's unhygienic to other people who might be swimming around you? People say, oh, it will make your cycle longer. All of these are bogus nonsense. Swimming while you are menstruating is perfectly and completely fine. There are so many period products these days that are compatible with swimming. Menstrual cups, tampons, they even make period underwear like swimsuits now, which is so cool. I just think that's so awesome, especially for young teens and kids who start their period earlier and may not be comfortable with menstrual cups or tampons yet. There's so many options now. It's awesome. So swimming on your period is perfectly fine. No hygiene problems, no danger. and you're not going to be more likely to be attacked by a shark. I promise. I get asked a lot if your period slows down while you're in the pool. Like if you are menstruating and you get in a pool, will your flow stop? And the pressure from being underwater does slow down menstruation a little bit, or what you would see like coming out, but not enough that I would ever say like go in a pool without a menstrual product if you're menstruating. So definitely make sure that you're using something that's compatible with swimming. The pressure is not going to slow it down to a complete stop. But other than that, no problems with swimming during your period. And in fact, some people find that to be really enjoyable exercise or recreational activity while they're menstruating because it can help some people with period cramps. So swim away. Don't let your period interfere with things that you want or need to do. Basically, if your period is affecting your ability to go about your normal daily life, either because of heavy flow or pain, or needing to change things because society or culture told you to, you need to talk to somebody about it so that we can help you out. That's definitely not normal, and we want you to live your normal life even while you're menstruating. Thanks for being here today, y'all. I hope that you learned something. If you're new, we'd love to have you subscribe. You can hit that subscribe button, and don't forget to check out Copilot, the sponsor of today's video.